Hey Jan, the rising cost of insurance is a major topic of healthcare reform. Why doesn't the federal government step in to control premium increases?
That might seem like a solution. But we need to understand what causes premiums to increase before making any knee-jerk reactions.
Speaking of jerks, I thought greedy insurance companies were the ones driving up premiums.
You've been watching cable news again. The issue is a little more complicated. Health insurance is expensive because the underlying cost of care is expensive.
Wait. What?
Premium increases are driven by the underlying cost of care. That includes hospital services, physicians, drugs, and other care. As those costs go up, so do insurance premiums.
I guess that makes sense. How do insurers determine the overall cost of healthcare?
Insurers estimate the future cost of health services by looking at past benefit costs and the behavior of people who are insured.
Sounds like driving down the highway by looking in the rearview mirror.
It's not quite that risky. Trends in healthcare costs and human behavior are pretty reliable indicators of the road ahead.
So by knowing how and why people use healthcare, we can tell how much it will cost in the future.
That's right.
Why not just align premiums and inflation? Couldn't we peg premiums to the consumer price index?
Medical inflation does not reflect actual payments by insurers to providers. It does not measure the volume of services used by consumers. It does not include the mix of services for a particular healthcare plan or geographic area.
So the consumer price index ignores important drivers of health insurance rates.
Actually, medical inflation is a component of these cost trends. But there are a lot of other factors. I haven't even mentioned the role that new technology plays in driving up costs. Technology can help improve the care but can also be expensive.
With so many factors, it sounds like legislating insurance premium rates cannot solve the escalating cost problem.
It is difficult for premium rate-setting legislation to contain the increases in healthcare costs that underlie health insurance premium increases.
So how do we control costs?
There are two main factors. First, there's unit cost. That's the price insurers and providers negotiate for each unit of service.
Sign me up. I would like to negotiate my rates.
You may need to open up a hospital if you want to negotiate directly with insurers. Unit costs respond to economies of scale.
So controlling unit costs is the key to controlling premium increases.
Unit costs are only part of the equation. There's also something called utilization, which is to do with the volume of services used.
And volume can vary?
Yes. It varies significantly across the country, often because of unnecessary or improper care that leads to waste and inefficiency.
I have also heard that people are more likely to receive care they don't need when someone else is paying for it.
That's right. The richness of benefit plans and the separation between consumers and payers can also affect utilization.
So you can affect premiums by focusing on utilization and unit costs?
Yes. It makes more sense to focus on these upstream drivers. You can learn more at healthcaretownhall.com.
healthcaretownhall.com. Thanks.